So my name's Ari Davis. I'm a research assistant here at the School of Pharmacy and Pharmacology at Griffith University. I'm obviously employed through the uni, and I have a supervisor here within the school and also an outside collaborator who's a skin cancer physician who has brought his research to the uni, which I'm now completing for him, yeah. Well, being a research assistant here at Griffith University, most of my work is actually involved in the lab. So basically in the lab, what we're looking at is a lot of cell culture work. And that's basically, we're doing this cell culture work to assess the cytotoxicity of black salve, which is a natural skin cancer therapy at the moment. It's not TGA approved or anything. So basically, we're aiming to hopefully get a better understanding of whether there's actually efficacy here for this black salve product, and hopefully be able to influence patients' lives in a like a productive, helpful way, basically. So pretty much every day I start my day with a coffee with my supervisor. We sit down and sort of discuss the plan for the week or the day. And then I'll get back to the office, check my emails. Like I said before, I have an outside collaborator too. So we just go over the things for the week. I'll then sit down and actually plan out what I'm going to do. So it's all in the lab, and it involves a lot of 96 well plates. So I'll print off some plate templates and sort of exactly plan out what I'm going to do well by well. And then that can also involve making up drug solutions, which involves a lot of calculations. So I'll look at the solubility of the drugs, how I'm going to dilute them, what I'm going to dilute them in, the ranges that I'm going to dilute them in, and then that normally takes me till about 9 o'clock in the morning. I like to start sort of early, and then yeah, most of my work's actually in the lab. So I'll jump into the lab. I've got a few cell lines growing at the moment, so depending on what we decided earlier in the day, I'll pick a cell line or whatever we've decided on and get to work. So most experiments kind of take 3 days. So my week is kind of in a 3-day shift. So Monday, Tuesday, Wednesday, and then Wednesday, Thursday, Friday. The thing I like most about my job is it's fairly different each week. So because it's constantly changing with the drugs and the cell lines that I use, it's never the same thing. Like you have to repeat some experiments, but there's always like something new to learn. So like pretty much every week I learn something new, which I really enjoy. It's nice to sort of constantly be moving forward. And then another key part is the team that I work with. I get to collaborate with a lot of people. So not just my supervisor and my outside collaborator, but like experts within my school. So I'll often just go and visit some people and say, look, I'm having this problem. Do you have any advice on what I could sort of do to move forward? And everyone within the school is really helpful. So I feel like we're a pretty tight-knit little school, which is nice. So probably the biggest skill that you need is problem solving. So like I said before, my weeks change week by week. So there's always something new and different. So you really need to be flexible on what you're doing, and you need to be able to adapt quickly and not stress too much under pressure, because sometimes it does get pretty hectic, especially when you're doing 30 calculations and one of them's not working. You've got to be able to adapt and not crack under pressure. And then also another key one is actually being patient. So as again I said before, most experiments take 3 days. So you've got to be able to sit back and just let the science happen and know that you've made the right call. But if it doesn't go the way you've planned, you also have to be level-headed and realise that something's gone wrong, be able to take a step back, reassess, and then move forward again. One of the most challenging parts of my job is when things don't go right. It's really hard to take a step back and look back at what you've done with a clear-headed mind and sort of see where the issue is. There's nothing more disheartening than doing something for 3 days and you've put all this time in and you're excited for the end result, only to finally get the product and it hasn't gone to plan, and you just sort of sit there and you're like, oh, I don't know what's happened. Like, was this me? Was it the drugs? Like, there's always variance in things. So the biggest challenge is really just having like a scientific mind. You really got to be able to just like, from an outside point of view, just look at what you've done, know that it hasn't been a fault of yours, and then be able to move forward confident in your skills and just sort of continue with your work. Yeah. So why I chose pharmacy and pharmacology started back when I was in high school. Chemistry was one of my favourite subjects, and I also sort of liked the health-related thing. I always knew I wanted to work in the health industry, so with that I kind of landed on pharmacy. So first year I started in pharmacy, and then sort of quickly decided that I wasn't interested in the clinical side of pharmacy, but more the research side of things. So I completed the 3-year undergrad of the Bachelor of Pharmaceutical Science. And then from that, knowing that I wanted to do research, I then undertook an honours year, which is basically just a 1-year-long research project. It's not really about what you find, it's more just learning research skills. And then I was lucky enough halfway through that year after having gained all of these lab experiences, I got offered this job just because I'd already really proven myself in the lab and was capable of doing this job. So I kind of wrapped up the stuff in my honours lab work and then just continued this straight into the lab work for this job. So it was a really smooth transition between the two. I learned a lot in my honours year. It taught me how to research, all of the lab skills I learned, taught me how to communicate with the staff members because I soon after became a staff member too. So it sort of just flowed from high school wanting to do chemistry into my pharmacy undergrad, into pharmacology, and now, yeah, I get to work in the area in a lab that I really enjoy. So I transitioned into my job while I was actually still finishing my honours degree at uni. So I was about 6 months in. I'd already completed most of the lab work when one day my supervisor took me into his office and said, "Oh, I might have a job for you. Are you interested?" And I was still studying, so it kind of caught me off guard a little bit. And I sort of said, "Oh, what do you mean? Is it teaching?" And he's like, "No, I want to get you a job actually in the area." So I said, "Oh, that's a good idea. Let's do that." And then from that, I was able to meet with my outside collaborator who I mentioned before. We kind of discussed what he wanted to do and how we were going to do it. And he obviously knew that I still had to finish my honours, which was still the priority at the time. But we sat down and made a plan and really figured out how we could fit both my lab work and his lab work in. I was sort of at the finishing end of my honours, so it was kind of good because I was winding that lab work down, which meant I could just basically move straight into another set of lab work, a completely different area, and it was fairly stressful at the time, but the transition was pretty smooth because I had both my supervisor and my outside collaborator working together with me to basically figure out a plan that will suit me the best. And in the end, it paid off well. I was able to finish an honours degree, get first class honours, and work full time as a research assistant at the same time, which I don't think many people can say they've done. So yeah, that was a nice little reward for me for finishing my honours, I suppose. What I would have wanted to know most would have been just how many jobs were actually out there. So when I started my Bachelor of Pharmaceutical Science, I kind of kept getting pushed in the direction to do pharmacy, and I knew fairly early on that pharmacy wasn't for me. But as I sort of talked to more people and became more familiar with the staff, I got exposed to a lot more jobs. I think the biggest problem with the industry that I'm in, sort of like the pharmaceutical science industry, is most people think, oh, if you want a job, you have to go overseas. Like, I always hear people say, oh, there's no industry in Australia or anything like that. So it would have been nice to know just how many jobs are actually in Australia. Each week, me and my supervisor sit down and we just go and seek and see what's around. And I was surprised there was a job like pretty much exactly what I'd be qualified for going in Southport just in the last week. So it really would have been nice to actually have a better idea of where my degree could have taken me. There's so much out there that we just weren't really exposed to because it was fairly heavily pharmacy. So if you weren't interested in pharmacy, I sort of felt like you got a little lost. But I'd really encourage people to sort of actually explore more what's out there. There's a lot of industry jobs, pharmacy jobs, chemistry jobs that just aren't broadcast. The biggest piece of advice I would give is to just talk to your lecturers. They're obviously going to be your biggest influence and the most help finding your career in the future. There's so many opportunities within the school that you can be exposed to, but you wouldn't know existed if you just didn't ask. So I'd really encourage people to take any opportunities they can get, whether that's just like a summer research project or just asking a lecturer if there's any research they're involved in or industry placement jobs that they know are going. Yeah, I think it's really important to stay active within the school and really get to know the staff members because at the end of the day, that's going to be your biggest help. It's really important to be exposed to everything that you can. There's been things that I've never thought I'd actually end up doing that I just got offered and I thought, oh, why not? I may as well give it a go. And then it's really shaped where I've ended up in my career. So like basically now I'm employed to do lab work, which I never thought would happen, but it all started just from a conversation with my supervisor where he offered me just to go into the lab and show me around. So if I'd never taken that opportunity, I really wouldn't be where I am today. So it's definitely important just to get exposed to a variety of things, whether that's through talking to lecturers or looking for industry jobs or just going out there volunteering within the workforce and seeing what comes up, yeah. Because at the end of the day, having the most experience will be the most helpful thing you can probably have, so.